Richard, thank you for agreeing to this interview.
Yep, that's
Firstly, you had a very interesting presentation. Can you give us a brief summary of your presentation and then pick out key highlights for us?
Yeah, I mean, the presentation was looking at two groups of depressed patients, a relatively mildly depressed group who had treatment with cognitive behavioural therapy, and a much more severely depressed group who were actually hospitalised because of their depression, who had treatment as usual in an inpatient unit. And we looked at neuropsychological function and emotional processing compared with healthy people for both of those two groups. The highlights were that at baseline, the mildly depressed group had problems with verbal memory and learning, but not problems in a number of other neuropsychological areas, and no differences in emotional processing. Whereas the severely depressed group had, across a range of neuropsychological domains of functioning, they had quite marked impairment compared with healthy people. And they also had some impairment in accuracy of recognition of facial emotional expressions, particularly the emotion of disgust, that they found it they were less accurate in recognizing disgust. And we then followed up both groups as they were treated. So the people having cognitive therapy were followed up at 16 weeks and had repeat neuropsychological testing. And the inpatients had follow-up at 2 weeks and at 6 weeks. Now, when we compared responders and non-responders in the mildly depressed group, they didn't really change differentially at follow-up. So at follow-up, there was no significant difference between the responders and the non-responders. And in fact, they were still different from the control subjects at that 16-week follow-up. In the severely depressed patients, there were certain functions that seemed to improve in line with improvement in clinical state, and they were verbal working memory and psychomotor speed, and also the accuracy of recognition, particularly of anger, seemed to improve in line with clinical improvement. So I suppose the highlight results were that in the mildly depressed group there was this relatively specific impairment of verbal memory at baseline. In the severely depressed group, the novel result is an impairment in the recognition of disgust. While at follow-up, the severely depressed group, there were a number of functions that seemed to improve in line with clinical recovery, and those were psychomotor speed, verbal working memory, and also the recognition of anger.
Now, you mentioned in your presentation the results being preliminary.
Yeah.
So what happens next? What sort of analysis or results are you hoping to
we have
share?
analysed the results in some detail and submitted them to journals. And I suppose really the preliminary nature of it was that I only had time to present the results in relatively little detail.
Okay.
We certainly intend to follow up these results and look further at emotional expression recognition, particularly in severely depressed patients compared with healthy controls. And also again look at the follow-up, what happens in the follow-up, particularly in terms of emotional facial expression recognition.
Now lastly, during the Q&A session there was quite a bit of interest about clinical tools and applications.
Yeah.
Can you just talk us through that?
Well, the hope would be that certain changes in neuropsychological function might indicate a good response, or if early on in treatment there was no change in neuropsychological function, that might indicate the likelihood that this person wasn't going to respond to that particular treatment. So if that was the case, you would change the treatment earlier than you might do simply by trying to monitor clinical response. But so far our data, particularly looking at changes after 2 weeks in the severely depressed group, don't indicate that any of the measures we use are serving as early markers of clinical response. But the hope would be that perhaps something will emerge, but it's not looking promising at this stage.